Okay, so now let's talk about what are the things we can look at to learn more about cancer, about your cancer and treatment. Okay, so I'll share with you just some sample questions and ways to gather information. Okay, so first thing is we might want to know what kind of cancer we have, what is the subtype of the cancer. A lot of times there are subtypes like breast cancer might have a ductal carcinoma or inflammatory cancer. The other thing we might want to know about the cancer is what stage is the cancer, and then what are the tests and procedures that might be done to diagnose and to get ready for the treatment, and then what are usually the treatment options. So a lot of times there might be surgery, one or multiple surgery, there might be radiation and chemotherapy. So we'll talk about surgery and radiation later. Let's talk more about the chemo. So the chemo, you might be getting it oral, which means it might be a pill that you take on a certain routine, or it might be topical, which means you apply it to your skin, or it might be an infusion, which means it's given in your veins. Okay, a lot of times as part of the treatment plan, the provider might discuss with you whether you need a port or a pick, or if it's going to be a peripheral IV for an infusion. So what do these words even mean? So peripheral IV is just a catheter that's inserted to give you your infusion on the day of the treatment, and then it's taken out afterwards. Port and pick are also catheters that are inserted in your body for the infusion, but they can stay for a longer period of time so that you don't have to get an IV every time you're getting your treatment. Okay, so let's talk more about your chemotherapy. So chemotherapy is usually given as a regimen. So what's the chemotherapy regimen? So a chemotherapy regimen is based on research and studying past patients who have got this treatment. They've figured out what dose, frequency and combination of drugs is going to be most effective for your type of cancer. Okay, so what do I mean by that? So for example, if your doctor says that you're going to get AC Taxol, so AC Taxol consists of 3 chemotherapy drugs: adriamycin, Cytoxan and Taxol. Okay, and it may be given every 3 weeks, or it may be given on a weekly basis, so depending on what frequency your doctor decides. And then the dose, it's based on your weight and your cancer stage and other information. So that might determine how dense is the treatment. So what is the concentration of the treatment you're getting? Okay. So now let's talk about other things that we can start to think about. Now that we know what the regimen is and what the individual drugs are, then you can start to look up information on those drugs. So they're usually called chemo. So you can look up information on your chemotherapy, and with a lot of chemo there comes side effects. So then you can look up what are the side effects of chemo, and for those side effects, are you going to be getting any medications? So what medications you might get on day of treatment, and what might be the medications that you might need to take at home, so before or after your treatment. So for these, you want to find out if you need a home prescription for medications, and then you can have those ready before you actually get your infusion. Okay. The other thing I want to point out is that there is a difference between side effect and adverse effect. So side effect of chemotherapy are symptoms that are expected when you get it, and then adverse effect is symptoms that are not expected. So these are things, if you're experiencing an adverse effect, you want to inform your doctor about these. Okay, so it's a good idea to understand the difference between side effect and adverse effects of the treatment. Okay, the other thing you might want to find out is if you want to be in a clinical trial, and if there are any clinical trials that might benefit you. And the other questions are more related to the day of your treatment, so that you can be ready for it. So for example, you might want to get a sense of how long your treatment lasts. So is it going to be an all-day event, or is it going to be a few hours, and how often, and how you're going to feel afterwards. Can you drive? Usually not, but that's something to find out about. Okay, the other things is can you eat on day of treatment? And so then you can bring food. A lot of times you're allowed to eat, and sometimes you might not be, so it's a good idea to find out if you can eat before you come in on the day after your treatment, and whether you should bring food with you. And then your regular medication. So for example, if you are already taking some medications like for diabetes or blood pressure, then you might want to find out if it's okay to take regular medications or not, and which ones you can take and which ones to avoid, and how much time before. So for example, if there is certain medication that you need to avoid for 48 hours or 24 hours, that's a good information to find out, so it's not an unpleasant surprise on the day. The other thing with medications also is what medications to bring with you. So for example, if you have pain and you are on some prescription pain medications like morphine, then that's something that if you come for your outpatient infusion, we might not have. Your staff might not have that medication on hand, so it's good to bring that with you, and that's something you can ask if it's okay for you to take it when you're getting your treatment. And the last point I can think about is who you can call when you have question, whether who you can call during the day, who you can call at night, and who can you call if you are not feeling well. Okay, next let's talk about where you can look up information.